This is my friend Lizzie. She's 6 years old. She's getting her chemotherapy treatment here at the Helen DeVos Children's Hospital. And we were just talking about plans for the future. What would you love to do someday? What would be a fun job?
Doctor.
To be a doctor? That would be cool. I'd like you to meet Nurse Candy, who when she was a kid, she came to a children's hospital and then decided to become a nurse.
I was 12 years old, and it was about Christmas break, and I had a backache, and my mom thought it could have been pneumonia, so I went to the doctor, and they found a heart murmur, so they brought me here to Helen DeVos Children's Hospital, and it ended up being non-Hodgkin's lymphoma. I would come in every 3 weeks for an overnight stay for chemo, and then I went for bone marrow transplant. After a year, I came back, and Dr. Fryer, who was my oncologist at the time, he said, your chances of the lymphoma coming back are very, very slim. So that's kind of the day we celebrate, is the day that I got my bone marrow back. And after my experience, I was like, I think I want to go into nursing. And, I didn't want to be any nurse. I wanted to be a PT monk nurse.
We remember her from many, many years ago, and she was a patient in our program right here at Helen DeVos Children's Hospital. And from that very beginning, despite some very long odds and some very difficult therapy, she was just an extraordinary, strong-willed, courageous young lady.
I'm a nurse in the clinic here, in the outpatient clinic, and so my roles and responsibilities are, we primary nurse here, so I have certain families that I work with them closely with their care, and you give their infusions and schedule their chemo and deal with the side effects and arrange for any other type of interventions they may need.
What an inspiration for a newly diagnosed child to have your nurse come up and say, I really have been on that road, I really have been in your shoes, and here I am, this successful, capable, wonderful nurse in our clinic.
I didn't really know that she had had cancer right away. So once I learned that, I was kind of like, whoa, that's cool. It helped me because then I know that, yeah, other people have gone through it and survived.
To work here and be a patient here can be inspiring, to patients who are maybe currently living where I was 17 years ago, and to know that beyond this moment where they can't see past right now, there's going to be great things that are going to happen in the future.
Seeing a success story like Candy brings so much hope and encouragement and strength to the childhood cancer journey, and that's something that, despite our best efforts and despite our best therapies, the best communicator of that message is really someone like Candy.